Still from San Diego. These are my disclosures, none of which are particularly relevant. So this talk is about bioactive implants and cost. So it probably stands to reason that I should first define what we mean by bioactive. So not allograft, not solid tie, not smooth peak, and at least in this context, not really some of the enhanced peak options like tie-coated or porous. There are a lot of different iterations. What we do mean to talk about are primarily 3D printed porous titanium implants. Is there a way we can put it back in presentation mode? There we go. Of various different surface roughening techniques, and this is something that, at least in the neurospine world, folks have been fairly obsessed with. So this is a general session, not like a breakout session or something like that from the joint section 2 years ago. And you can see it's like titanium plasma spray, rough 3D surfaces, biometric laser etched, comparison of 3D printed porous, 3D printed biometric titanium. It's like something that neurosurgeons have, at least of late, become fairly obsessed with. So what we're trying to kind of study is implants that have an effective modulus that is similar to bone, have some porosity for ingrowth, and then have a surface architecture that has some stimulatory capacity for surrounding osteoblasts and osteoprogenitor cells that promotes osseointegration. And that's what we'll consider a bioactive implant for the purpose of this talk. So incremental value, I think when you're considering this, at our hospital, we pay a premium for these 3D printed porous titanium implants compared to smooth peak. And as I'm sure many of you have experienced in your own practices, you can get pretty good results in terms of fusion with smooth peak implants if the implant is big enough and occupies enough of the anterior column.